The concern that's growing by the day, the situation inside our nursing homes. They're full of vulnerable loved ones, providing perfect havens for this virus to spread.
And we continue to see new outbreaks popping up and current outbreaks expand. Look at this. These are the local congregate living facilities with outbreaks. There are nursing homes in Burke, Cabarrus, Cleveland, Mecklenburg, Rowan, and Union counties, all dealing with outbreaks. There are also residential care facilities in Mecklenburg, Stanley, and Union counties. It's leaving residents and their families afraid and feeling helpless.
We shouldn't have to die like that.
This has been a concerning and a widespread issue. Channel 9 is really dedicated to covering, so much so we've put 2 reporters on it.
Yeah, let's begin with Tina Terry. Tina, you're live outside a nursing home with at least 96 positive cases. You just spoke to a man who says his great aunt died inside the facility and they never even told him.
Yeah, that man says that he's power of attorney for his 98-year-old aunt, and he says when she died in this facility, no one called to tell him. Tonight, he just wants answers.
She was our last oldest living relative, and she kind of was the glue for the family.
Ronald Barber didn't get the chance to say goodbye to his great aunt, Dorothy Cleveland. He says she died Tuesday at the Citadel in Salisbury, but he says no one here told him. Instead, he says he found out nearly 24 hours later when a funeral director called him on the phone.
Mr. Alexander said, Ron, do you need to come up here and make this appointment? I said, make an appointment? He said, did they not tell you Miss Cleveland passed away? I said, no, sir. No, nobody called or anything.
He called the facility several times to speak to the director.
She put me on hold, and it was about, 10, 15 minutes. It was on hold. My wife just told her just hang up. She never did come to the phone.
His aunt had recently moved to the hospice care in the facility. Now he wonders if she was one of the 96 patients here who tested positive for COVID-19, an outbreak he says the facility never told him about. Today, Rowan County health officials told me they're still working to help the facility overcome the outbreak.
They are doing everything within their power to help provide the most appropriate care.
But Barber wishes management had done more to let him know his aunt was nearing death, and he wishes he could have said goodbye just by phone.
It's bad enough she had to pass along, by herself. I just wanted to tell her that I'll see her again in heaven one of these low days.
And Phil Barber says he still has not heard from that facility today. Now, I called the facility on the phone. I asked to speak to a manager. They told me to wait. I did that, waited for several minutes. No one ever came to the phone. I reached out to the parent company via email as well as by phone. We're still waiting to hear back from them tonight, Phil.
Thank you.
The Citadel is just one facility that's dealing with this kind of widespread problem.
Channel 9 continues to take calls from family members and staff concerned about outbreaks inside other local nursing homes. Mark Becker continues our coverage now, focusing on a facility here in Charlotte and asking, where does the law stand?
More than 30 nursing homes and 10 rest homes in the state now have at least 2 cases of coronavirus. The Social at Cotswold is one of them. They've let families here know that 15 residents and 1 staff member have tested positive. And all those family members can do now is trust that they're doing the best they can here to control it.
It's just very frustrating, and you want to help, but you realize the only best thing you can do is social distance.
Gary Burkhardt is on the outside looking in, and sometimes that's tough. His mother is in the Social at Cotswold, and he talks to her on the phone, says she sounds fine, but there's no way to know for sure, since this facility is locked down and he has no way of checking on it.
I don't know. All they say is they're following the guidelines. And so, I don't know if they're cleaning properly. I don't know if they're always wearing a mask. I don't know.
The same can be said for hundreds of families since the coronavirus has caused an outbreak in more than 30 nursing homes and 10 rest homes around the state. Serious questions have come up about the care in some of them, including that home in Salisbury where 96 residents have tested positive.
I think you will see lawsuits.
Attorney Brad Smith says state law is very clear. If nursing homes don't properly care for someone, they can be held liable. And he told us he expects we'll see that happening once the danger is past.
Is it possible to prevent a spread like this? Of course not. But are there certain things that a reasonable person would put into place in order to hopefully prevent it? I think there is.
I think it's fair to assume that most nursing homes and rest homes are doing the best they can. But family members and friends won't really know for sure until the danger and the virus are gone. Back to you.
Nursing homes have become a vulnerable target for the pandemic nationwide. Most facilities have had strict visitor rules for weeks, but the virus has still made its way in. A tragic example in New Jersey where police just found 17 bodies inside one of the state's largest nursing homes. They say the facility was understaffed and overwhelmed.
Now we want to take a moment to give you a snapshot of where our communities stand against this virus.
Let's get you caught up on the current case numbers. Mecklenburg County continues to lead the state with over 1,000 cases, and across North Carolina, a surge in new cases, more than 300 of them for a total of over 5,400. The state also added 14 more deaths for a total of 131. But we also want you to see this. Those 5,400 positive cases are really just a fraction of nearly 71,000 people who have been tested. And out of all of those positive cases, 452 are hospitalized. South Carolina is giving an update on cases right now and just announced 276 new cases in the state, bringing the total to more than 3,900. There are at least 107 deaths in the state.